3, go.
Hi, my name is Hope Williams, and I'm going to be talking about medication administration. So first, before administering any medication to a patient, I am checking the order with the MAR, noticing any labs or any other information that would help me determine the actual administration process, any allergies or anything like that. Then, so if it was an oral medication, it would either be like a pill or a liquid. So for a pill, I would, obviously any medication, I am checking the expiration date. I am checking, for any like tears in the package, anything that would compromise the medication itself. So I would open the medication, put it into a cup. If it was liquid, you could do an oral syringe or also a cup. Before administering to the patient, I'm making sure it's the right time, the right dose, the right patient, using 2 patient identifiers. And watching my patient, making sure they take the whole med. If they can self-administer, if not, I could perform any interventions needed to help administer the medication, to make sure that they do take it. I would never leave a medication with a patient. Always check and make sure they're not pocketing, anything like that. And obviously always coming back to assess throughout my shift for any adverse effects or other notes like that, and documenting the administration immediately after with any interventions I had to put into place or any other information needed. Other types of injections, so for intramuscular, you want to go at a 90-degree angle, the deltoid, or the ventrogluteal, also like subcutaneous, 45 to 90-degree angle in the abdomen area, and then we also have intradermal, like for a TB test, that's at a 15-degree angle, just under the epidermis, enough to cause a little bit of a bleb, a bubble. For the intradermal, this is not a TB syringe, it's the closest one we had. It's around the same size. You really only want to inject 1 milliliter, like I said, right under the skin, enough to create a bleb. Obviously, before injecting, assess the site, wipe the area with alcohol, making sure the area is clean, and then assessing the site again afterwards for any adverse effects. With a vial, so before drawing up your medication, you want to first check, make sure it's the right medication, check for, again, expiration or anything that'll compromise the medication inside. Wipe off with an alcohol swab. Prepare your syringe by attaching your needle, making sure it's the right gauge, appropriate, things like that. You're going to pull back on the needle to gather air, the same amount of air as the medication you'll be injecting, as the dose. Inject the air into the bottle, invert, and draw back the medication, making sure the needle always stays under the fluid level. If there's any air bubbles, you can push it back in, draw back out, or take the whole needle out, kind of like flick it and manipulate it a little. Once you take the needle out, don't go back in. And then again, administering medication, the medication, following the 6 rights of medication administration, verifying my patient with 2 patient identifiers, assessing the site, cleaning the site with alcohol swab first, letting it dry thoroughly before injecting medication, and again, assessing for any adverse effects throughout my shift, and documenting immediately, time, dose, route, however. With ampules. So with ampules, first thing you want to do is make sure that all the liquid is out from the top by flicking it. Get a piece of gauze. You want to snap it away from you in case any little shards of glass tend to fly out. And then placing it back down. Same thing with a syringe. However, the first step is to do a filter needle. So you're going to attach a filter needle, which helps take up the medication while filtering out any little tiny bits of glass that could have fallen into the medication. again, you know, you don't have to inject air, but inverting it, it won't spill even though it's open, just due to the air pressure. And then the same type of administration, assessing for the site, and all of that, documentation and those steps. Lastly, when you're disposing of your needle, make sure never to recap after injecting, making sure to dispose it into the appropriate sharps container. And for insulin, make sure you use an insulin needle. It's measured in units. Medications like insulin, heparin, they require not only for you to check and make sure it's the right dose, right patient, right everything like that, but also to have another nurse check that you have the right dose as well. And then again, like I said, it's measured in units, and that would be like a sub-Q injection, 45 to 90 degree angle. And again, just making sure you always follow the 6 rights of medication administration, always assessing your patient for any adverse effects, and always, you know, really making sure it's the right dose, and always using documentation appropriately.